Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this useful, you're of course welcome to take it and use it as you see fit. Just please make sure you do so safely. So I wanted to make a video to illustrate an exercise that I give to a lot of patients, particularly who have anterior shoulder issues or sort of any sort of rotator cuff pain. What we often find with people with shoulder injuries is pressing motions can become particularly painful. I've certainly experienced this myself. But what we often notice is that the more compromised the shoulder is, so the more extended the shoulder is, the more painful the exercise becomes. And of course, we want to eventually challenge that, tackle that, and eliminate that, because we don't want to just accept that we can only sort of push with a certain range of motion. So this is an exercise we sort of came up with that allows you to train the push-up, which, you know, the humble push-up that I'm sure you remember dreading doing in gym class when you're in school, but with a reduced range of motion. And then, of course, you can eventually increase the range of motion and get that full range back over time. So I'm here with Dan, and Dan's going to demonstrate this exercise. So as you can see here, I've got one 20-kilo bumper plate and one 10-kilo bumper plate on top of each other. This is about 12 centimeters. So basically, we are doing a reduced range of motion push-up, which is reduced by 12 centimeters. So Dan's just going to illustrate this. Really simple. You hold the starting position, and instead of coming all the way down to the floor, we do chest to plates. Exactly. And what Dan's going to do now is going to take 1 second of rest. He's going to re-engage the scapula, and he's going to come back up. Excellent. And just let's go again. Lower slowly, under control. Really, really good. Rest a second, re-engage the scapula, and come back up. That's awesome. Thanks, Dan. Beautiful. And with this one, as I've just told Dan, we want to favor or prioritize increasing the range over increasing the number of repetitions. So instead of, let's say Dan was doing like 6 repetitions at this height, rather than moving to 7, 8, 9, 10 repetitions, I would prioritize increasing the range. So we do that by removing a plate. And so now that's sort of more like 8 centimeters, and then eventually until you're lower and lower and lower down onto the floor. So that is the decreased range of motion push-up. We use this to improve our pushing range, pain-free range after shoulder injuries. I hope you found that useful.